Okay, welcome everyone to this ANA webinar, which we hope will be the first of many as we embrace the opportunities of new technology. My name is Julia Lyon, and today we're talking about the issue of food labelling. Certainly it's a topical one, and one that many people are keen to explore further, as I can tell from the number of people signed up for the webinar. It may interest you to know that food labelling is not a new issue. In fact, as this picture shows, the Egyptians were setting rules around food labelling in their hieroglyphics centuries ago. Now, I'm not sure whether food labelling was as hotly debated back then, but certainly today, although we tend to agree we need to change the way information is presented on food packaging, we can't seem to agree on which system we should take. In this webinar, you're going to learn about our new series of evidence snapshots. And on the topic of food labelling, you're going to have a crash course on the evidence around the why, who, where, and what of food labelling. I'm then going to hand the presentation reins over to Dr. Rachel McLean so you can learn about the findings from her research on labelling and consumer choice of high and low sodium foods. We've got a lot to cover today, so we might as well just get started. So late last year we sent out a survey asking you to tell us about your experiences accessing and applying research in your work. Now these snapshots are a response to that feedback and a commitment from us at Agencies for Nutrition Action to get the most out of research being undertaken in New Zealand and abroad. The snapshots, they follow a series of 5 questions which were tweaked from a framework developed by Boyd Swinburne and colleagues, which was initially designed to help translate obesity research into action. The snapshots have been targeted towards people with limited knowledge on a particular issue, and in this case food labelling, so that they can be better informed to participate in future debate. So without further ado, I present the key messages from our food labelling snapshot. It's important to point out that food labelling is just one part of the jigsaw when it comes to helping New Zealanders make healthier choices. Research shows that if food labels are understood, they have the potential to empower shoppers at the point of sale to purchase healthier foods. As many of you will know, the only mandatory labels we have in New Zealand are nutrition information panels, and research shows that shoppers struggle to use and understand them. It's hard to argue against the fact that it's a consumer right to know what's in our food, but with fewer of us cooking from scratch and instead relying on pre-prepared meals, snacks and ingredients, it's just getting a lot harder to do so. So while we used to compare peaches with peaches, we now find ourselves having to make rapid comparisons between tinned peaches in syrup, peaches in juice, peaches in clear fruit juice, peaches with no added sugar, or just plain old peaches. What we really need is a shift in strategy towards a system that can be interpreted at a glance and doesn't require background knowledge and high levels of literacy and numeracy to understand. So who should we be targeting? Well, we live in a country that essentially believes everyone deserves a fair opportunity. But it's the same communities who currently have fewer opportunities to succeed that are disadvantaged by our current system. Research shows that Māori, Pacific and low-income communities are less likely to use and more likely to have difficulty interpreting nutrition labels, and this finding is consistent with international research. Knowledge is power, therefore we need to create an environment where all New Zealanders can access information about what is in their food. And finally, while one system will not suit all, a system that works for high need groups will most likely work for the general population. The reverse, however, is unlikely to be true. Support has been growing for front of pack labels, and here are just some examples from around the world. Research shows that information presented on the front versus the back and side of a packet can be more likely to influence shopper behaviour and can also encourage product reformulation. Shoppers like these labels because they can provide nutrition information at a glance, while NIPs or nutrition information panels continue to provide more detailed information for those who want it. So essentially they complement each other. The downside of this growing popularity, however, has been that as support has grown, so too has the number of labels on the market. And research suggests that the coexistence of numerous labels has only added to shopper confusion, and in some cases may have even encouraged people to eat more than they otherwise would have done. So really what we need is one simple standardized system that translates information from the nutrition information panel to an easily understood health message, making healthier options easier to identify. And the snapshot makes reference to these 6 labels, and although there are more, these are the ones that are most often referenced in the literature. In relation to those 6 labels, the snapshot provides a summary of the pros and cons of each and the literature on shopper use, preferences and understanding. It also summarises the research on whether front of pack labels influence food purchases and consumption. In brief, this research suggests shoppers largely prefer traffic light based labels over other labelling formats. It also shows that traffic light labels are better understood across all ethnic and income groups and better at helping shoppers to identify less healthy products. And finally, the evidence, although limited, is emerging that a traffic light based system implemented over a range of products may result in a shift to healthier diets over time. One of the biggest obstacles to implementing traffic light based labels is that they are generally opposed by food industry. And these pictures here are of what we would consider different traffic light based labels, and the bottom one was developed by Sanitarium, so it seems that there is still some potential for finding a common ground. So at the time of writing the snapshot, the best evidence available suggested, first of all, that a labelling system without limitations does not exist. And secondly, it is difficult to conduct robust experimental studies in the real world setting, so therefore there are limitations to the current evidence base. And finally, further research is required, particularly with New Zealand's low income, low literacy and ethnically diverse populations in the real world setting. And ideally this research should be funded and led by neutral groups who do not have a commercial interest in food labelling. So essentially the take-home message from the snapshot is this: shoppers need a simple guide on the front of food packaging that helps them to quickly identify healthier foods. The best available evidence suggests that in comparison to other label formats, shoppers will be more likely to use and understand traffic light based labels. However, further research and work is required to help develop a traffic light based system suitable for adoption in New Zealand. And I think it's important to emphasise that many of the criticisms that have been based on traffic light based labels are criticisms of the UK based system, and this evidence snapshot is not recommending that we simply pick up and plonk the UK system into New Zealand. But what it is recommending is that whatever we introduce, it really needs to be mandatory to help reduce shopper confusion. And it also needs to be accompanied by a comprehensive education campaign to enhance the ability of all consumers or all shoppers and all population groups to use and understand the system. This slide here just provides a list of actions you can take, and as many of you will be aware at the time of this webinar, New Zealand was currently in the process of developing a voluntary front of pack labelling approach, and I've been informed that a group has recently been established to oversee the development process. However, at the time of the webinar they were yet to meet. Finally, I just wanted to acknowledge the peer reviewers of the snapshot and say that the snapshot itself is available on our website, as was said in that previous slide. And now I'm going to hand it over to Rachel for her to share her research on the effects of alternative label formats on the choice of high and low sodium products in a New Zealand population sample. Bear with us as we switch screens through the marvels of technology, because Rachel is coming to us from Dunedin while I'm in Wellington. So Rachel, it's all yours.
Thank you. Kia ora, everyone. Thank you very much, Julia, for inviting me to present this paper, which was published earlier this year, and is obviously highly relevant to the ANA snapshot. Please let me know if my slides don't progress. So yes, this is the paper, The Effects of Alternative Label Formats on Choice of High and Low Sodium Products in a New Zealand Population Sample from the journal Public Health Nutrition. And I just need to go into a bit of background about dietary sodium because this is the area that I'm particularly interested in at the moment. We know that an excess in dietary sodium is associated with a number of adverse health effects, elevated blood pressure, increased risk of cardiovascular disease, particularly ischemic heart disease and stroke, and also a number of other conditions. And we also know that interventions to reduce dietary sodium intake on a population level are highly cost effective and likely to result in decreased morbidity and mortality, as well as decreased healthcare costs. Excuse me. The current dietary recommendations from the nutrient reference values for New Zealand and Australia recommend an upper level of intake for adults of 6 grams of salt per day, which is about 2,300 milligrams of sodium. And what we know is that the mean population intake for New Zealand is actually around 9 grams of salt per day, about 3,600 milligrams of sodium. So clearly in excess of the recommended upper level. And we're not alone in that. You can see if you scan down the list, New Zealand, Australia, USA and Canada have similar mean population intakes, and some Asian countries have intakes that alarmingly exceed that recommended upper level. We also know that in a Western style diet, about 90% of the sodium we consume is sodium chloride or salt, and that about 80% of our intake comes from salt that's already in processed food, and only about 5% is added in the home during cooking and another 5% added at the table. So if we think carefully about the maths, even if we were able to completely eliminate the salt that people added at the table and in cooking, we're only going to be able to reduce our population intake by about 10%. So if we think we're eating 9 grams of salt, we might be able to get it down to 8, but certainly that's in excess of the recommended upper level of 6. So we need to actually tackle the amount of sodium that we're consuming in the processed food. And the United Kingdom have initiated a really effective sodium reduction strategy, and they started that in about 2003, and it's really led the world as an example of an effective strategy. And that involved action at a number of levels. It involved working with the food industry to reformulate processed foods to contain less sodium, and they published and set targets for the amount of sodium that should be in processed foods in a number of areas. It also involved a consumer education campaign, and you can see the poster in the bottom right hand corner, Sid the Slug, who really led the public education campaign. And it also involved improvements in food labelling and the implementation of a voluntary traffic light based system. So changing public behaviour, using food labelling to change public behaviour. Great idea in principle. It's really great that we have a commitment to educating consumers and to letting people know what's in the food that they purchase. But we also need to provide consumers with information they understand to enable them to actually change their behaviour. Food labelling also enables us to promote individual responsibility. We have a government that has come in and virtually abolished the Healthy Eating, Healthy Action program with the criticism that it was too nanny state and that we should promote individual responsibility. Well, I think that improving food labelling is an ideal opportunity to do that. So food labelling is an important strategy, but in practice we know that consumers read information on food labels less than we expect and less than they self-report. And as Julia indicated, we know from New Zealand research that Māori, Pacific and low-income shoppers really use the nutrition labels that are currently in use in New Zealand.